So we will be discussing the cardiovascular physiology, the circuitry, and hemodynamics. So for the circuitry of the cardiovascular system, we'll first discuss the principles. So we have here the formula: the cardiac output is equal to the heart rate times the stroke volume equals the venous return. So remember that the cardiac output of the left heart is equal to the cardiac output of the right heart. So the left heart, where is the systemic blood flows happens, and in the right heart, the pulmonary blood flow happens. And at rest, the cardiac output is 5 liters per minute, and the maximum cardiac output for non-athlete is 20 liters per minute, and the maximum cardiac output for athletes are 30 liters per minute. And there's another formula that the blood pressure is equals to the cardiac output times the total peripheral resistance. Okay, so what are the difference between the pulmonic circulation compared to the systemic circulation? So the pulmonic circulation has lesser resistance, has decreased after load and decreased stroke volume, but they have the same preload and heart rate and stroke volume as well as the cardiac output, same with the systemic circulation. So the blood flow per 100 grams of tissue is greatest in kidneys. So what are the components of vasculature? We have here the arteries, the arterioles, the capillaries, the venules, the veins, and the lymphatic vessels. So for the arteries, these deliver the oxygenated blood to the tissues, and it is thick-walled with elastic tissue and smooth muscle, and this is working under high pressure, and it contains stress volume. So that's the arteries. And next is the arterioles. This is the smallest branches of the arteries, and this is the site of greatest resistance, and it have smooth muscle wall innervated by autonomic fibers. So there's alpha 1 and beta 2. So the alpha 1 vasoconstricts, and it is found in arterioles. So the blood flow here decrease, and the TPR increase. And this alpha-1 receptor is found on arterioles of the skin, in the splanchnic and renals. And another thing that we can find is a beta-2 receptor, and the function of this one is to vasodilate, and it is found on the arterioles of the skeletal muscle. And the function of this is to increase the blood flow and decrease the total peripheral resistance. So that's the arterioles. It is the site of greatest resistance. And the next one is the capillaries. This is the largest total cross-sectional area, and it consists of single layer of endothelial cells surrounded by basal lamina. It is thin-walled, unlike the arteries, which is thick-walled, and this has the slowest blood flow velocity. So the capillary has the slowest blood flow velocity, and the metarterioles and precapillary sphincters control the blood flow. And this is the site for exchange of nutrients, water, and gases. So that's the capillaries. Next we have the venules. So this form from the merged capillary. Another one is the veins, also known as the capacitance vessels, and there are 64% of blood that found here. And it merged to form larger veins, such as the vena cava, which is thin-walled, and it works under low pressure. Unlike the arteries, it is under high pressure. So these veins contain unstressed volume, contrary to the arteries, which contain stress volume. So in veins, it's unstressed volume, and it has alpha-1 adrenergic receptor. So that's the veins, also known as capacitance vessel. And next is the lymphatic vessels. This drains proteins and fluids from the interstitium, and it carries chylomicron, and it is involved in immunity as well as in cancer. Okay, so let's run through the direction of the blood flow, or how does the blood circulate to our body. Okay, so as we can see here, there is the head and the upper extremities that will pass through the superior vena cava, and the blood from the trunk and lower extremities will pass through the inferior vena cava. So first let's discuss the blood from the right heart, or what we call the pulmonary blood flow. So there will be the deoxygenated blood from the tissues going through the superior vena cava or the inferior vena cava, and from that vena cava will pass through the right atrium. So from right atrium, the blood will pass to the tricuspid valve going to the right ventricles. And from right ventricles, the blood will pass through the pulmonary valve going to the pulmonary artery. And from the pulmonary artery, the blood will now go to the lungs for oxygenation. And then we will be now discussing the blood flow from the left heart. So there will be oxygenated blood from the lungs going to the left atrium via the pulmonary vein. And from the left atrium, the blood will pass through the mitral valve going to the left ventricles. And then from the left ventricles, the blood will go to the aorta via the aortic valve. And from the aorta to systemic arteries and to systemic tissues such as the cerebral, coronary, renal, and splanchnic, skeletal muscle, and skin, the blood can circulate. So that's the direction of blood flow. Now let's discuss the hemodynamics in cardiovascular physiology. We'll be discussing the velocity of blood flow, the resistance, the capacitance or compliance, the pressure profile in blood vessel, the venous pressure versus atrial pressure, and the arterial pressures. Okay, so first, we'll be discussing the velocity of the blood flow. So we have here the equation. The velocity is equals to the blood flow divided by the cross-sectional area in centimeter squared. So the velocity is measured in centimeter per second, and the blood flow in milliliter per minute, and the cross-sectional area is centimeter per squared. So the blood flow velocity is inversely proportional to the cross-sectional area. So it means that if the smallest the cross-sectional area, the fastest the velocity is. So the fastest velocity is found in the aorta. However, the slowest blood flow velocity is in the capillaries. So for the blood flow, we have here the equation. The flow is equals to the pressure gradient over the resistance, or the TPR. Now there's another formula for the blood flow where the cardiac output is equals to the mean arterial pressure minus by the right atrial pressure over the total peripheral resistance. So this equation of the blood flow is analogous to the Ohm's law for electrical circuit, where the current, as you can see here, the I, or the current, is analogous to the flow, and the voltage, or the letter V, is analogous to the pressure. So the blood flows from high pressure to low, and there's the Ohm's law also have the formula here, the pulmonary vascular resistance, where the pulmonary arterial pressure is minus to the left atrial pressure over the cardiac output. So that's the pulmonary vascular resistance equation. So the atria, or the atrium, is the chamber of the heart, which is the primer pumps of the ventricle, and 80% of the blood flows from atria to ventricles before the atria contracts, and the atrial contraction is responsible for 20% of ventricular filling, and it is not necessary in resting state. So there are 300 to 400% of blood in the heart that pumps at rest, and it becomes an issue only during exercise. Atrial damage may lead to shortness of breath. Now let's go to the resistance. So for the blood flow, we have the Ohm's law equation, or related to the equation in Ohm's law, that the flow is equals to the pressure gradient over the resistance, or TPR, or the cardiac output is equals to the mean arterial pressure minus the right atrial pressure over the TPR. Here in the resistance, we have what we call the Poiseuille equation. So this equation indicates that the resistance is equals to the viscosity of the blood, and the length of the blood vessel, and over the radius of the blood vessel raised to the fourth power. So this is the Poiseuille equation. So the viscosity of the blood is equivalent to the hematocrit. So the more viscous the blood is, there are higher hematocrit, so there will be polycythemia. So the more the increase the viscosity, or increase hematocrit or polycythemia, there will be increased resistance. And if the resistance is decreased, therefore the blood flow will be decreased. And the relationship of resistance into the blood vessel radius is indirectly proportional. So if the blood vessel radius is decreased or smaller, there will be increase in resistance. And example of this one is the if the blood vessel radius is decreased by factor 2, resistance increased by factor 16, because if you multiply the 2 into the fourth power, like 2 times 2 is equals 4. 4 times 2 is 8, and then 8 times 2 is 16. That's why the resistance is increased by factor 16. And the blood flow is decreased by factor 16. Okay, so we have a resistance in parallel or series. So in parallel, this is illustrated by systemic circulation. And we have the equation, so we can see resistance of renal, hepatic, and other arteries. That's the total resistance. The total resistance is less than the resistance of any arteries. So when the artery is added on the parallel, the total resistance decreases. So but the pressure is the same in each artery. When artery is added in parallel, the total resistance decreases. And for the series, the resistance is illustrated in arrangement of the blood vessel. So the total resistance is equal to the resistance of the artery, resistance of arterioles, and resistance of the capillaries. So the arterioles has the largest portion of resistance and same total blood flow, but the pressure decreases. We also have what we call the laminar flow versus the turbulent blood flow. The laminar flow is what we call the normal one, where there is streamlined or straight blood flow, and the blood velocity is fastest in the center and slowest near the vessel wall. However, in the turbulent blood flow, this is irregular and disorderly blood flow, and it is associated with high Reynolds number or greater than 2000 Reynolds number. And it is also associated with bruit, or this is what we call the audible vibration, the bruit. And the Reynolds number is increased by decreased blood velocity. So if there's decreased blood velocity, the Reynolds number is higher. In cases where there is decrease in hematocrit, or there will be an anemia, and if the blood velocity is increased as well, the Reynolds number will also be increased in cases where there are patients with atherosclerotic blood vessel. So these are the factors that increases the Reynolds number. If there's decreased blood velocity, such as in anemia or decreased hematocrit, and if there's increased blood velocity, such as we can see in atherosclerotic blood vessel. Another one in the resistance we'll be discussing the shear. So this shear is the consequence that blood travels at different velocity within the blood vessel. So this is shear. The velocity is 0 at the wall and highest at the center of the blood vessel. But in shear, it is highest at the wall. The velocity is highest at the wall. Going back to the turbulent flow, we have here the Reynolds formula as what we've discussed a while ago, where the Reynolds number is equals to the density of the blood and the diameter of the blood vessel, as well as the velocity of the blood flow. And it is indirectly proportional to the viscosity of the blood. So that's the Reynolds formula. And another trivia is for turbulent blood flow, the anemia, it is caused by anemia. And for the higher resistance to blood flow, it is polycythemia. Okay, so remember this, don't be confused. So turbulent blood flow might caused by anemia, and higher resistance to blood flow might caused by polycythemia or increase in viscosity. Next, let's discuss the capacitance or compliance. We have here the equation. The capacitance in milliliters, mercury, okay, equals the volume in milliliters over the pressure. So this capacitance or compliance, distensibility of the blood vessel. So it measures the distensibility of the blood vessel, and it is inversely proportional to elastance or stiffness. So the higher the elastic tissue, there will be higher elastance, there will be decreased compliance. So the capacitance of the vein is greater than the artery. And the ratio to venous compliance is 1:20. So there are more volume contained in veins, there will be an unstressed volume in veins than the arteries, which has the stress volume. And the capacitance of arteries decreases with age. So that's the capacitance or compliance. So the more elastic the tissue is, there's decreased compliance. So what are the pressure profile in the blood vessels? In aorta, we have 120/80. In left ventricle, it's 121/0. And in right ventricle, it's 25 systolic. So pressure differential between aorta and in the left ventricles, it's -1/80. In the right ventricle, it is 95/80. Then we'll discuss the arterial pressure. We have here the systolic pressure, the diastolic pressure, the pulse pressure, and the mean arterial pressure. So for the systolic pressure, this is the highest arterial BP during the cardiac cycle, and it is measured after the heart contracts or systole. And the diastolic pressure, this is the lowest arterial pressure, and it is measured when the heart is relaxed or during diastole. And the pulse pressure, the equation of this one is systolic pressure minus the diastolic pressure, or there's another equation that is stroke volume over the arterial compliance. And this is the most important determinant of pulse pressure is the stroke volume. So remember that the stroke volume is the most important determinant of the pulse pressure. And there's decreased capacitance in aging that causes the pulse pressure to increase. Next is the atrial pressure or the mean atrial pressure, the MAP. The formula of this one is 2/3 of the diastole plus the 1/3 of the systole, or diastole plus the 1/3 of the pulse pressure. That's the formula of the mean arterial pressure. Now, let's differentiate the venous pressure versus the atrial pressure. So the venous pressure has low pressure but high capacitance. However, in the atrial pressure, it is lower than the venous pressure. Okay, another trivia is the normal pulmonary arterial pressure is within 15 to 25/8 or 8 to 10 millimeter mercury. And the normal ratio of systemic and to pulmonary pressure is 3:1. And the synonym for the right atrial pressure is central venous pressure. So when you say central venous pressure, it is the same with the right atrial pressure. And what is measured using Swan-Ganz catheter? It is to estimate the left atrial pressure. It's the pulmonary capillary wedge pressure. That's the one that measured by Swan-Ganz catheter. The pulmonary capillary wedge pressure, or also known as the left atrial pressure. Okay, again, let's remember that the arterioles controls the blood flow, and it is the main determinants of the total peripheral resistance or systemic vascular resistance. Another trivia are the layers of the arteries and veins. So we have here the tunica intima, which is the endothelial cells, and the tunica media, which is the smooth muscles and adrenergic receptor, and the tunica adventitia, or the most outer layer, it is the contains the connective tissues. So that's all for our cardiac physiology, circuitry, and hemodynamic topic.